So thank you all for joining today. Just a few quick announcements. We next month in May are going to be having our Housing Is Summit. So we hope everybody can join us there. It's going to be in Washington, D.C. We are going to have a number of great topics like this one, and we'll actually have a breakout on a very related topic about how King County Housing Authority partners with their public health department.
And Camille froze. So for those of you who don't know me, I'm Abra Lyons-Warren. I'm the Director of Cross-Sector Initiatives here at CLAPA. So I did go ahead and drop a link to the summit in the chat. Sandra, if you wouldn't mind just slacking Camille to tell her she is frozen, that would be great. Thank you. As Camille was saying, at the summit, we have plenary sessions on topics that are related to anything cross-sector, but we also have breakout sessions. Loosely, we have housing and education track, a housing and health track, and then a partnerships track. And so we have so many great sessions for you. At the link I provided, you can see a list of all the breakout sessions with their descriptions and the panelists. And in the coming weeks, we will have the plenaries up there as well. So I know some of you have already registered. Super excited to have you join us. There's still time to register if you want to come. It's May 11th and 12th in Washington, D.C. We will be launching, I believe, the week of April. Yes, I believe on April 18th, we'll be launching virtual registration for the summit. So what that will look like this year is we will be repeating all of the breakout sessions. All of those sessions will be happening virtually. And so you'll be able to participate live in all of those sessions if you're joining us virtually. And you will also then receive recordings to the plenary sessions if you register virtually. Now, if you come in person, then you do also get recordings. You do also get access to the virtual sessions. So that's a really great option. If I know I always hear from folks, I couldn't decide which session to go to. We agree. We think they're all super interesting. So it's a really great perk if you do come in person that you can attend one in person. And then next week, the following week after, go to a different one virtually. Those will also, you'll also get the recordings of all of them so you can watch them at your convenience. So I think with that, I'm trying to think if we have any other announcements. We'll at one point during this drop into the chat the link for the remaining working group sessions that we have for this year, just so you have that at your fingertips. But in just a moment, we'll get this started. So I will turn it back over to Camille.
Thank you. My internet crashed on me and Zoom had to restart. So thanks, Opera, for taking over. All right, well, we're going to kick off today talking about partnering with health departments by having Caroline Brazil. Am I pronouncing that right, Brazil? Okay. From the Association of State and Territorial Health Officials. Caroline's going to be talking about some recent work that she's been doing and ASTA overall about partnerships between health agencies and housing agencies. So they've recently done an assessment, and she's going to share some recent findings as well. So I'll let you go ahead and kick it off, Caroline.
Thanks so much, Camille. So before I screen share, do y'all mind just like doing like a hand reaction of whoever's on the call if you have an existing relationship with your health agency? Or, you know, raise your hand if you're on video, that's okay too. Okay.
Yes, or use the reactions. There we go.
Okay. All right. Okay. I see a couple of people. Okay, cool. If as I'm talking, y'all have questions or you want to pause and go deeper on something, please drop it into the chat. And Camille, feel free to come off mute and interrupt me. I tend to talk fast when I'm giving presentations, and I'm going to try really hard not to do that because I would love to be oh, Camille, can you let me screen share it saying I can't?
Not letting I will make sure.
Yeah. But I want to make sure to get any questions answered and to make sure that this is as valuable as it can be for y'all. And now let me go big. Okay. I'm gonna swap. Are y'all seeing presenter view or the slide view?
Presenter view.
Okay, all right, let's swap. Here we go. All right.
Great.
So I'm Caroline Brazil. I am the Senior Director for Population Health. And I wanted to start my presentation with this quote by Paul Farmer, who was a famous epidemiologist who did a lot of really important work in Haiti and also in Boston, Massachusetts, and started the Partners in Health organization. With rare exceptions, all of your most important achievements on this planet will come from working with others, or in a word, partnership. And I think that that is really the foundation of what is so critical about our approach to working with sectors outside of the ones that we're in. So today, what I really hope to do is provide a little bit of background about public health and ASTHO, share some insights into emerging and strategic priorities for state health agencies and their leadership, and then talk to you a little bit about a project that we did last year on my team with Rhode Island and New York that I think has some good takeaways around what works, and what kind of barriers you could potentially help a state health agency address to developing work with housing, and then highlighting sort of some next steps and tactical takeaways. So the Association of State and Territorial Health Officials is a national nonprofit. We're based in DC, but we have staff all over the country. And our main focus is to support the appointed public health leaders in the states, territories, and freely associated states and their staff. So it's about 100,000 people across the country that work in state public health. And we recently reworked our strategic plan for the next couple of years as we came out of COVID. And what you see here are our organization's strategic priorities of health and racial equity, workforce development, sustainable infrastructure improvement, data modernization, and evidence-based practice. And the way that we deliver on those priorities and support our members in those spaces are through advocacy and communication efforts. Because of the way public health is structured, there really isn't a central coordinating body or voice at the national level to really represent the interests of public health with the different federal funding agencies. And ASO is funded in the same way that our states are. So we really are able to serve as that coordinating voice and represent their needs with CMS and CDC and HRSA and sort of those usual characters of federal funders. We also provide some capacity building and technical assistance, and that really is the vein in which the work that I'll talk about in a minute falls into, where we'll meet with a group of states around topics that are important to them, but they may need some help with strategy development around, and we'll connect them with each other. And then leadership development and cultural and operational excellence work, which is really our body of work around supporting the people that are moving into those state health agency leadership roles and helping them get up to speed on what it takes to lead a health agency and what the national priorities are. So public health is generally categorized into these 4 key pillars of work, which roll up into a body of public health work called the foundational public health skills. So state health agencies run the gamut from preparedness and response, epi and surveillance, disease prevention and health promotion, and regulatory oversight work. And in each of these 4 pillars, there are different opportunities and ways that they could be working with you on common programs to support the people in the community that you're both working with. Something that I also want to point out about public health is that the structure and governance of a state health agency differs across the country depending on what state you're in. And the reason this is important is that depending on, the structure of your housing authority, you may need to work with someone at the state, and you may also need to work with someone at a local health agency. So if you're a centralized organization, what that really means is you may have local public health employees, but those people are technically employees of the state, and their reporting structure rolls up to the state no matter what. And if you're decentralized, the funding for that county health agency and the staff for that county health agency are county staff. because there has been so much staffing turnover and there's so much limited capacity and issues just in that particular workforce vein in public health right now, I just want to call out how important the governance structure is, because it may actually make it a little bit more tough, I think, if you're coming from a housing perspective, trying to work with public health, trying to find the right person. It may make it a little bit more tough to navigate right now than it may have been previously. But that is also something that my team and ASTHO are happy to help you strategize around and think through. And Camille, I'm welcome you to connect anybody who's on the call to me afterwards if that would be something that would be helpful. The other thing I want to point out, because I think that all three of these programs are also important to those of you that are working in housing, are that some of our members do oversee the Medicaid program in addition to their public health programming. Most of them oversee the WIC program, and then a heavy contingent of them oversee or have a sort of organizational collaboration with their SNAP program. And so these are all some tactical spaces where if you're living in a state that's an orange state and oversees Medicaid and you want to develop a partnership with public health, it's important for you to know that you could also have a very coordinated conversation about what public health and Medicaid partnership looks like in the context of housing. The WIC directors are a great point of entry for collaboration with state health agencies. There's opportunity to work with them directly on service alignment and referral collaboration and care coordination. There's also a way that you could approach them as your sort of like common denominator staffing point of entry and ask them for facilitated introductions to other members of the state health agency. And I would say the same is true for the SNAP program. So public health agencies do have a really key place in maintaining the healthcare safety net, which is more important now than I think it has been in a long time because of the Medicaid public health emergency unwinding and all of those eligibility redeterminations starting up again. So I do see a real place here where public health has service delivery programs that are financed, like the Ryan White HIV/AIDS program, some substance use treatment work, the WIC program, and then also financing the healthcare workforce and addressing sort of the pipeline of both physicians and nurses and federally qualified health centers that are getting established. You know, this common space of access to care is a really nice niche for considering how you would partner with public health and what sorts of supports they could bring. So in terms of zooming out a little bit and thinking about what is a priority right now for public health and for state health agency leadership, there's a huge amount of funding that has been allocated to state public health that is really creating its own like center of gravity right now. It's called the Public Health Infrastructure Grant. It's managed by CDC, and it includes funding to both address workforce investments, so like the systems that public health agencies are using to staff and support HR functions. It's also being used to build up and shore up the data systems that public health has, and that's a component of a very large-scale national data modernization initiative. And the final thing that I'll say about high priority issues, I think coming out of the pandemic, it became very clear that public health and the healthcare delivery system needed more consistent mechanisms for how we collaborate and how we sort of facilitate work, whether it's policy work or care coordination work as a component of direct service delivery. And I think that this is an important place for y'all to be aware of, because there's a mutual need here, I think, between public health and housing and how we collaborate with and work with the healthcare delivery system. So that could also be a nice space to team up and think about strategy together. ASTHO does an annual survey of our state health officials, and in last year's survey, what you see here in orange on this wheel were the key things that came up for them as emerging priorities. And there's not a single one that to me isn't an opportunity to also work with housing or to collaborate with your housing partners on addressing. The climate change and extreme weather one in particular really resonated. I live in New Orleans, Louisiana, and we're about to go into hurricane season. And that's a real place, both from a preparedness perspective and also just an equity perspective, you have a lot of opportunity to really address the needs of a community in collaboration with your housing authorities. So I'm not going to spend a ton of time on this, but it's just another reinforcement of what was specifically coming up. So when state health officials were surveyed and they were asked about their top 3 priorities, 20% of them flagged community-driven work to address the social determinants of health. And you can see specifically they're calling out housing. And I'll get into this a little bit later, but public health really does struggle to figure out what is our role, what can we do, what's the thing that would be most supportive. And that's just something I want you to hang on to for in a minute when I talk about some of the specific work that we did. I'm going to sort of fast forward through this section because I've already talked about it, but I just want you to know that the slide is in here and I've included links to each of the funding websites that kind of go into more detail about this funding. I do want to point out from an equity perspective, this $427 million that you see here is the single largest carve out for rural health that has ever been authorized for federal public health funding. And there's some lessons learned from how that's gone that I think are important for y'all to consider too. The work really was to support state health agencies in responding to the lack of equitable care and equitable access that people from different populations had over the course of the height of the pandemic and its various waves. And it was meant to really give rural health, public health representatives that work in rural health a seat at that leadership table. So public health funding, if you work in chronic disease, you work in chronic disease, and it's very rare that you were also collaborating with HIV. And so if your issue that you're working on isn't somehow at the top of the priority list for your leadership team or your governor, it's really hard to get that elevated focus. And this funding and the way it was structured was really meant to elevate it. So I think that there are parallels there for housing work and elevating housing with public health. And one of them is that in states where they didn't already have an established partnership between their, general public health programs and their offices of rural health, it was much harder to get things started up. And there was no existing strategy that they could plug into. And the reason I call it out is that you may feel like getting coffee with somebody at the state health agency or your county health agency is not doing enough. But actually building that relationship is one of the single most important things that you can do, and letting it be natural and letting it evolve at a sort of non-pressurized pace is actually the investment that tees you up for being ready for future funding opportunities. Now, I'm going to zero in on the next couple of slides on health equity within public health, because this is potentially a place where if you don't have an existing counterpart at the state and you're trying to figure out how do I come into the state and build that relationship, this is a really good person for you to work with. Just about every state has a health equity director, and most of them you can see report to either the state health official or their senior deputy. So that's another avenue through which, if you're working with health equity, their boss then is able to take that full, department perspective of, oh, how do we address housing across everything that we're doing? And instead of saying, how do we address HIV in housing, right? And these priorities here you can see are the ones that were coming up as most important for health equity directors. For some reason, there's another image here that's not showing up, but you'll be able to see it in the slide deck. But I want to call out here that there's a lot of training work that state health agencies are doing right now around health equity. And you can see here that they either offer this training or they are conducting this training for their own staff around implicit bias, cultural humility, and structural racism. So another thing that you could potentially do with your state health agencies, if you also need your staff to be trained in these concepts, you could host a joint training, and you could use that training as an opportunity for people to meet each other and have a sort of like lower lift way for those relationships to get established without the pressure of responding to a funding opportunity or sort of being forced to come up with some strategic focuses. As sometimes I found in my work at the state health agency that was really the work that organic relationship development was the most crucial and ended up producing some of the best and deepest work. I'm going to spend a few more minutes talking about this work with Rhode Island and New York. One of the things that I want to point out that was really obvious to us in that work is that our members need more clarity on their role and their scope of their role related to working in housing policy and partnership. And I'm pointing it out because I think that that's something that you can already give them. And that's a real resource that they deeply need. And you'll see that in what I'm about to share with you, that you don't have to do anything new for. There's so much about how housing works that you never learn in public health. And I'm sure that y'all feel the same way about the way public health works. So truly all you have to do is show up and talk, and they're gonna hang on your every word. I would imagine, at least that's been my experience with them when housing comes up. They're just hungry for it. And data utilization and just partnership management are where people tended to find a really good hook for building a stronger relationship. So I'm not going to go into a ton of detail about how we stood the project up. What I want y'all to take away from this slide is that so much of what ASTHA provided was just scoping and helping them figure out, well, what do we know? What do we not know? What do we need to learn? And figuring out what questions they had and helping them answer it. So they would have questions like, what are the housing related data indicators that are most important for our housing agencies? And how do we need to align to those? And so our team would go and dig in and pull the work and pull a couple of examples of dashboards and send it back out to the states. And so those are things that if you have visibility into that, or if you have data initiatives and you've got measures that you want to share with your state health agencies, data is always a great place to link up with them. I mentioned earlier that the way partnerships look from state health agencies with housing, from what we're seeing, there's no one model. I wish I could tell you do it this way. But I think it really does have to be driven by, what you're looking for, what you're ready for, and what the state is looking for and what the state is ready for. So you can see these two states were in totally different places. They have different governance structures. They had different partners. Like I never thought that the Academy of Medicine would be the housing partner with the state and local health departments, but they were. And I think that really does sort of loop back to the fact that you have to have organic development if you really want to have true partnership, and you've got to build in time to let yourself figure that out. Like it's not going to feel clean at the beginning. So what both projects did, so New York State was doing training around healthy aging and housing in place. Or aging in place. And they put together a public health focused dashboard of housing indicators to track the impact of housing policy on community health outcomes. And Rhode Island, as a part of their health equity zone initiative, was very focused on the built environment. So how do you create healthy homes, and how do you really reinforce HUD's healthy home principles, and how can public health participate in reinforcing that? And what the biggest barriers were from a state health agency perspective was that internal subject matter expertise. And again, that's something you already have. So just by building the relationship with people at public health, you are helping to supplement their understanding of what is housing, what does it mean to work with housing, what is most critical and important to you as an agency and partner. And then in terms of sustaining that partnership, the relationship and identifying an external subject matter expert. So in both states, they had an external organization to the state health agency that really provided that support. They established common meeting rhythms and common goals. And then they did an internal environmental scan of like who across the state health agency is doing housing work and how are they working together. And sometimes would build like a work group to talk about things internally. So I've talked a little bit about these things, so I'm not going to go too deep. And again, you'll have a copy of these slides, but I think the data analysis pieces of being that hook of really driving clear common goals together and using data for evidence-based policymaking, those are some places where there was some really nice synergy. And then creating those partnerships and really building that community to state connection with housing partners was a really rich space where we saw a lot of success. So in summary, you can see this like sort of path, and this is kind of how I think about opportunities for authentic partnerships with housing and health. States are always going through some version of accreditation planning. So there's a public health accreditation board that accredits state health agencies. So that's a really good way to get involved, is to sort of get involved in those accreditation planning meetings. There's also strategic plan development and state or community health improvement planning that happens regularly. So making sure that you are at those meetings is a good way to sort of have visibility from a broad perspective. And then, like I've been saying, meeting with your health equity directors and thinking about what are your opportunities to sort of come at state health agency collaboration from that perspective is smart, as well as that data modernization piece. And remembering that there's nothing wrong with going to your state and asking them to be a convener. Like, sometimes that simple ask, they are happy to do. So if you are having a particular set of issues that you're really struggling to address, you know that there's a diverse group of stakeholders that you need to pull together, but you don't have the time, you don't have the space, and you feel like maybe having somebody that's in a more neutral spot pull people together would actually be the thing that would help you. Public health is perfectly equipped to host a meeting like that, build an agenda in collaboration with you, facilitate through it. And they may not be able to fund the solutions, right? But if part of what you need is convening people to get to a common understanding about a shared problem, that is exactly what public health is supposed to do. A big part of why I keep reinforcing the data modernization and health equity pieces is that I'm sure, like y'all, public health agencies are just plagued with a lot of just people retiring, people being burnt out, tough recruiting. So being strategic in how you approach them is really important, and thinking about what can you layer housing onto. And then being clear with your asks. It's okay to go to public health and say, I need this from you. They actually want you to say that to them, because they are having a hard time figuring out what would be most helpful. Some states are further along than others, but I promise your feedback is probably quite welcome and would also help them make sure that they're prioritizing the right things. So I've got some resources that I dropped into the back of the deck here for you that ASTA has produced. My contact information is here. I would love to be in touch with y'all if you want to talk more about this. And then I also dropped in some of the kinds of questions that we get from our state health agencies. These are things that New York and Rhode Island asked us to help them with research around, just to give you some tactical examples of, like, what don't state health agencies know and what level of information might you need to come prepared when you're trying to have that first conversation with them. So Camille, I hope I didn't take up too much time, but thank you so much for inviting me. I love being able to work with CLAFA, and it's just really good to be here. I'm happy to answer any questions if people have them.
Thank you. That was perfect amount of time. That was an excellent presentation. I personally have so many follow-up questions, but I encourage anybody to use the chat right now, and then we'll definitely come back to questions after we hear from Akron. So I did want to also invite our friends from the Akron Metropolitan Housing Authority to share their experience working with their public health department. After Kelly Morehouse presents, I would love to just have people from around the virtual room also share how they're working with their public health departments, what's been the most valuable ways, what have been the hangups. I really like to hear from a lot of you, because I know a lot of you on the phone are working with their public health departments in different ways. Kelly, I'm going to turn it over to you.
All right, thank you. Thank you, Camille, and thank you, Caroline. My name is Kelly Morehouse. I'm the Health Initiatives Coordinator here at Akron Metropolitan Housing Authority here in Ohio. We partner with Summit County Public Health in a variety of ways. I'm just going to go through a few of those and just give a little bit of a description, and promise not to take too much time here this afternoon. One of the first ways, and probably one of our most extensive ways that we partner, is with the full-term first birthday Greater Akron. And I'm going to read a few of these just because we've all been in rooms where we've spent lots and lots of time to choose the right words to really express what we do. So I'm going to read what our full-term first birthday Greater Akron is. It's a collective impact collaborative advocating for policies, educating our community, and informing citizens of programs that promote healthy full-term pregnancies and ensure every child celebrates a first birthday. So their 2023 priority is safe sleep. Every week in Ohio, 3 babies die in unsafe sleep environments. Ohio ranks rather poorly in the nation for infant mortality. We're 47th, and our African-American babies in our county are dying at a rate that's almost double that of the county. So safe sleep is definitely a priority, and the way that the Housing Authority is partnering is being engaged, like Caroline said, just showing up and talking. We have a staff member in each of the subcommittees of Full Term First Birthday. Society, which is focused on more of the federal, state, local built environments, looking at housing, racism. Then interpersonal, which is the biological and personal history, age, education, income, substance abuse, all of those interpersonal factors. Community, which is looking at schools and workplaces, neighborhoods where those social relationships are occurring. And then the individual, which is the close relationships, the partner, the family member. So we do have somebody on each of those subcommittees representing the Housing Authority and being that voice at the table. Another area is maternal depression. We have maternal depression support groups. We call them Mommy Time. Our information is on Summit County Public Health's website. We are doing those virtually right now. However, we were doing those in our community rooms pre-COVID and hope to get back to that very soon here, having them in person. We also engage in the baby showers, community baby showers that our health department does fairly frequently. One of the ways is having our staff there to share information about our early childhood initiatives, our Parents as Teachers program and our Spark program, and providing changing pads for those that come to the baby shower. Another thing with Full Term First Birthday is training opportunities have come about that I was prompted when Caroline was talking about training. We have been able to access different training programs. One was the groundwater training through the Racial Equity Institute that just occurred, and they had everybody that was on that Full Term First Birthday committee that could attend that. And they also partnered with Summit County, it's a little bit later down, Summit Coalition for Community Health Improvement, trying to get everybody kind of on the same level of knowledge and commitment to health equity. And then along with Full Term First Birthday, we do offer a preference point to pregnant moms. Summit County Public Health holds that decision making for who receives that preference point for housing, but that is also a piece. Caroline mentioned WIC. We do have WIC appointments available at some of our public housing family developments. And then they do have an office in one of our more remote locations that are difficult for residents to get to their other sites. Let's see, the Summit Coalition for Community Health Improvement. I did mention, I'm going to read that description too. It's an interagency collaborative committed to identifying key health priorities in Summit County and coordinating action to improve population health and promote health equity for all. And that is the committee that's really looking at those community health assessments and developing the community health improvement plans. Priorities for our county right now: adolescent health, aging population, chronic disease, maternal and infant health, and then mental health and addiction. Of course, COVID-19 response. We worked very closely with the health department, getting our residents access to vaccinations and COVID tests. We're still receiving COVID tests to be able to provide to our residents individually, and also at our distributions, like our hotspot distributions, our early childhood events, and other type of events that we have here at the Housing Authority, so that we have those available to anybody that needs to grab some for their family. Also, educational materials were abundant over the COVID-19 response for, why to get vaccinated, prevention, and all of that we were able to access. Smoking cessation is another area. We do have Summit County Public Health staff that provide workshops on site at our properties, as well as we give referrals for the Baby and Me tobacco-free program that they have. Our senior and adult services, we collaborate on grants such as CDC's Healthy Brain initiatives. We make referrals for that program and for the direct service for clients through Direction Home, Akron Canton area. I always say this, Area Agency on Aging and Disabilities. My apologies. The other one is Minority Health. We're participating in their Minority Health Fair later this month, giving information about housing, how to apply, as well as information about our programs through resident services. If people already are a resident of ours, making sure that they have all the information and they can tap into all the resources that we provide. The other, we sit with Summit County Public Health staff and in a lot of county initiatives. Two that I'll quickly mention, Summit County Trauma Informed Care Coalition and the Summit County Suicide Prevention Coalition. And then I will just end with the data sharing and the data dashboards. We have come a long way with the data dashboards, getting to be able to, more have that more up to date and accessible to the community as a whole. So I'm very grateful for that. So yeah, we look forward to continuing our partnership and expanding it in the future. And I will stop there, Camille.
That was great, Kelly. Thank you. I knew you all worked a lot with your public health department, but I actually had no idea of all the different things that you do with them. Like I said, I'm going to prompt some other people to jump in and talk about how they have been working with their public health departments. I saw hands at the beginning, so I'll call on people if I have to. I'm going to kick off with calling on people. Ed Lowndes, do we have you on the phone? Can you talk about how you work with your public health department at all?
Yes, this is Ed Lowndes, excuse me, in Kansas City, Missouri. We work with our health department in a couple different ways. One, each year they do their application for lead-based paint funding. We're a partner in that, not only in the investigation, but also in the reporting. We also were invited to participate with our health department in their strategic planning, in that they've taken the position that housing is a determinant of health. So they always ask for our input on their strategic plan. And the third way that we do a lot of participation with them is the city passed a few years ago what they call their healthy homes. It was a way of regulating rental properties and the conditions of rental properties. So we collaborate a lot with our Kansas City Health Department on that. Then we just have just ad hoc relationships and various aspects of regarding that, including working with them when they set up various healthy cooking classes or other aspects with our residents. And typically we'll do that also in conjunction with University of Kansas, which is in our immediate vicinity as well.
Thanks, Ed. You're always great for sharing out, so I knew I could call on you.
Thank you.
All right, there's a couple more hands. I saw Martha Matthias had her hand. I wrote them all down real quick. Martha, can you share?
Hi, sure. Realize that we need to do a little bit more collaboration. Some of the stuff we worked on, of course, is COVID, getting vaccine clinics into our different housing communities. We've been working with them on the opioid crisis to try to get Narcan to our residents, or at least to inform them on different ways that they can get Narcan for them. What else? Oh, we have a big fire season out here, so they have assisted us. They got a grant for some fans that had filters on them, so people could have, air purifiers in their buildings, and helped us distribute them. And what else? We need to do more work. I will say that.
No, that it sounds like you're already doing a lot with them. So no shame here. We're all learning. I think the fans are really interesting with the filters. I know some of the new Medicaid waivers that are coming out. One of the things that they can do is actually pay for some home renovations and things like fans with filters, particularly for those who have asthma or COPD and other health conditions. So that was a really good one that just kind of triggered that actually now in some states, Medicaid would pay for those materials as well. Gloria, you also had raised your hand. You also said that you worked with your health department.
Yes, good afternoon. As others, we have been working with the health care on bringing vaccinations, different types of vaccinations to our population, both in the family and in the elderly disabled population. We work with Boston Medical Center on various initiatives like asthma, determining like within the home what has caused some health issues to address them. And we get some funds to be able to do reasonable accommodations, alterations to units to accommodate the various medical needs. In addition, we partner as supported housing programs to be able to house individuals who wouldn't be able to be housed unless they had different types of services, which they're getting through BMC and also through Boston Medical Center. We have the Healthy Starting Housing for high-risk pregnancies. We also work with the AIDS Action Committee to provide housing and stabilization services by the AIDS Action Committee for population to be able to be stabilized in the community. So it's a lot of work that we're doing, and we create individualized memorandum of agreements of what are the specific services with each partners that are going to be at the table for the residents, so that they could be successful at home and continue to improve their health care.
Thank you. Thanks for sharing. And Andy.
Yeah, hi, this is Andy Shine from Seattle Housing Authority. We've been working with the Public Health of Seattle and King County for almost a decade now, I'm going to say, and we've had quite a lot of data focus on what we've been doing to sort of like provide us a baseline, a background on things. One of the first things that we got involved in was a data dashboard. This cross-referenced public housing authority data with Medicaid and eventually Medicare information. So we have health service utilization records and demographics going back, I think, to 2016. We engaged in several research projects which are relevant to housing authorities, one of which is the HousingIs study, which you can learn more about at the HousingIs conference, so I'm not going to go into that too much. Little teaser. We also work working with public health and Johns Hopkins University on a study on the effects of housing on child health. They were very helpful when we were going through, hopefully we're through the pandemic, but in the early and mid stages of the pandemic, they helped facilitate many of our clinics. And we were also able through the data dashboards to identify which populations were under vaccinated, and gave us the opportunity to target vaccination clinics to underserved communities. We're also doing a review on whether there was an increase in deaths over the pandemic period. And a lot of this is also being facilitated through our participation in an integrated data hub. So public health, Seattle King County is the sort of the center of a large number of different organizations and data sources, so that they can pull from this with correct permissions and whatever, to from employment security, from HMIS, from the public housing authorities, if we give permission. So there's all kinds of different ways that we can do more and more research on with regarding our tenants and other folks. So that's kind of what we do.
Thanks, Andy. And I'm going to prompt both Andy and Kelly. You both talked about the data sharing and data dashboards. And I know, like you said, Andy, they've been going on for a little while. Have you seen any particular actions that have come out of this data sharing? Anything that you've walked away with it and being like, oh, wow, we really need to do something in this particular area?
Well, I think we have a lot of other health collaborations. One of which is with United Healthcare, and the amount of data that we have through the collaboration with public health has really been, I think, a help in targeting where practical collaborations could be placed. I'm a data person. I love data, but I would definitely say that we could be more concrete and in the way that we approach, now that we've started, or beyond started, to gather so much data. We need to really look into what are the practical ramifications of this, and I think that's an area where we could do more.
Yeah, I may just share my screen here and pop up one of the data dashboards, if that's okay, Camille. We don't have the level that Andy does out at Seattle as far as specific to Housing Authority participants, until the United Healthcare is new for us to be able to get that level of data. So what I'm popping up is going to just be county data. Let me see if I can do this easily here.
You should be able to.
Okay, can you see that?
It's working on it.
Okay. Maybe? Is it up?
Oh, there we go. Now it's loaded.
Okay. Okay. This is one of our data dashboards for infant mortality, which has really been able to guide interventions, if you will. So if you can kind of see it pulled like this little graph down here, the underlying cause of death, and you can look at, here's the accidental suffocation and strangulation in bed, which is guiding our interventions on safe sleep. And then you can look at specific, here's mom's race, African American, here's white, we've got marital status. So you really can look and target your interventions to where you're seeing the greatest need. So that's just one of them. I would say another one, there's 5 pages. I won't go into a lot of detail and take a lot of time, but you can look at everything from the birth weights, if mom's breastfeeding, this one's mom's weight gain. And again, you can pull it all out by marital status, educational attainment, race. So you really can tailor your interventions. And I would say another data dashboard that's been helpful is the deaths by suicide. And you can look at, tease that out by zip code, by, race, age, all of that. So you can really see trends and make the interventions, relevant to that demographic at that point in time.
Thanks, Kelly. That's awesome.
And I put a link to the Seattle King County Health and Housing Dashboard in the chat.
Thanks, Andy.
Oh, now how do I get out of this? I'm so used to Teams that then I get on Zoom and I'm like, how do I do it? I lost you all.
I might try and.
Yeah, there we go. Okay.
Great.
you.
Well, thank you. That's really helpful to see the actual dashboards and how you all are using them. Now, Caroline, I've got a couple of questions for you, and I can always talk plenty. So if you all have questions, please raise your hand or come off mute or use the chat function. So Caroline, a lot of our PHAs across the country are continually struggling with mental and behavioral health needs within their population. Are you all working on this much? Could you share a little bit about that?
Yeah, absolutely. So there's a significant amount of funding that's gone out to different aspects of the public health service system to support all kinds of different response to the opioid epidemic. So one core set of funding has come from CDC and has really funded state support of data systems and infrastructure around where there are available treatment facility beds and for what populations. So I was just in Nevada last week, for example, and they've built an entire similar, I think, in some ways to what Andy was talking about is in Seattle. They've built an access-based, like a bed-based system to look at if anybody needs to make a referral, who has an open bed and will that bed actually meet the needs of whatever person they're trying to support. So there's some funding from CDC to address things around that and to create like state and local strategy to respond to the epidemic. And then there's actually more infrastructural support that's coming from the Health Resources and Services Administration that will be reflected, I think, more in your federally qualified health centers or your community health centers. And that funding is focused on creating pipelines for providers who specialize in substance use prevention and mental health support, placing new federally qualified health centers, particularly in rural areas where there is such limited access to both primary care and specialty care. And also increasing the amount of training that's available for existing federally qualified health centers around responding to substance use disorder and mental health needs. So ASO is working in all of these spaces. And if that's a place where we can provide additional context or make connections between y'all and your people at the state or the county, we would be happy to facilitate that.
Great, thank you.
Mhm.
Now, I'm gonna see if you can answer this question for me. What are some of the more innovative state and territorial health departments around the country that you really think we should keep an eye on who's doing what, or if
Yeah.
they're in their state, they really should be jumping on, getting all the information from them as well?
Well, I think for y'all, especially tracking all the states that have these 1115 waivers is really important. So
And just real quick, the 1115 waivers are a Medicaid waiver, and there is a set that recently came out that's around, they call them health-related social needs.
Yeah.
And a lot of that includes housing and food
Mhm.
access, and also home modifications to help health conditions. So continue, Caroline. That's very
Yeah,
helpful.
of course. So I think really paying attention if you are in Massachusetts or in Oregon, really paying attention to how is your experience as a housing provider changing, if at all. It should be, but like how is it changing in the implementation of these waivers? And then because when I say the implementation of these waivers, what I really mean is there's now money available to pay for these services. So in theory, more people should be getting access. Is anybody reaching out to you from your Medicaid agency to strategize with you and plan with you about this? If not, for me, that's a red flag, right? Because why would you pay for something if you don't have the network established to support it, And in part, the payment is supposed to create the network. But I'm really curious about how is that actually unfolding in real time? What does that feel like for y'all? And I think this is another good place for looping back with your health agencies at the county or the state level to raise some red flags and say, hey, we know that there's a better way. Can you help us navigate this with Medicaid? Because public health will be experiencing those same growing pains. So I think partnering to sort of build stronger communication and collaboration with each other with Medicaid is a really good next step. And then I also want to call out Washington. So we've got some really great work with Washington. The data infrastructure in Washington state is fantastic. And a lot of what Andy was highlighting is made possible because Washington has an all-payer claims database. And that means that you can see healthcare utilization and claims for people from across an array of insurance perspectives. And I think, Andy, what you were saying about needing to be really thoughtful about now we've got the data, what do we do with it? How do we use it to inform our decision making? I think watching Washington and watching how that evolves for Andy is going to be really important for anybody that's looking to get into that space.
Thank you.
Of course.
Well, we are right on time. Caroline, we'll have to continue talking about all my questions for you. I I would like to prompt our audience, as Caroline mentioned, if you want connections to your state health departments, just reach out to me, reach out to Caroline, and we're happy to help facilitate connections. As you heard from a number of people, there's lots of great opportunities to not only work collaboratively, but also to bring resources to public housing residents. So there's just a lot of value available from building these connections. I would say thank you all who shared on this webinar today, and we hope you'll join us down the line for future webinars, and feel free to reach out. And as a reminder, we have our HousingIs Summit in May, so please join us there. Thank you all. I will talk to you all soon. Have a good one.
Thanks, Camille. Bye. all.
Thank you.
Bye.
Thank you.